If you're curious about Medrol and its uses, dosing guidelines, potential side effects, and user experiences, you've come to the right place. Medrol is a widely prescribed medication that belongs to the corticosteroid class, known for its anti-inflammatory and immunosuppressive properties. Primarily used for treating various conditions, Medrol is commonly prescribed for asthma, allergies, arthritis, skin conditions, and certain types of cancer. Primary conditions treated with Medrol. Medrol is commonly prescribed for a variety of conditions due to its anti-inflammatory and immunosuppressive properties. One of the primary conditions treated with Medrol is asthma. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, shortness of breath, and coughing. Medrol helps to reduce airway inflammation, making it easier for individuals with asthma to breathe. Another common use of Medrol is for allergies. Allergic reactions occur when the immune system overreacts to harmless substances such as pollen, pet dander, or certain foods. These reactions can cause symptoms like itching, sneezing, and hives. Medrol helps to suppress the immune response and reduce inflammation, providing relief from allergy symptoms. In addition to asthma and allergies, Medrol is also prescribed for various types of arthritis. Arthritis is a condition that causes joint inflammation, pain, and stiffness. Medrol can help reduce inflammation in the joints, alleviate pain, and improve mobility for individuals with arthritis. It is especially beneficial for those with rheumatoid arthritis, a chronic autoimmune disease that causes joint inflammation. Skin conditions such as eczema and psoriasis can also be treated with Medrol. Eczema is characterized by itchy, red, and inflamed skin, while psoriasis causes thick, scaly patches on the skin. Medrol helps to suppress the immune response and reduce inflammation in the skin, providing relief from symptoms and promoting healing. Lastly, Medrol is sometimes used in the treatment of certain types of cancer, particularly in combination with other medications. It can help reduce inflammation caused by cancer and improve the effectiveness of chemotherapy or radiation therapy. However, its use in cancer treatment is determined on a case-by-case basis by the healthcare provider. Dosing guidelines for Medrol. When it comes to dosing, Medrol tablets are available in varying strengths to accommodate individual needs. Your doctor will determine the appropriate dose based on your specific condition and response to treatment. It's essential to follow the prescribed dosing schedule and not exceed the recommended dose to avoid potential side effects. For asthma and allergies, the typical starting dose of Medrol is usually around 4 to 48 milligrams per day, divided into 2 or more doses. The dose may be adjusted based on the severity of symptoms and individual response. Once symptoms are under control, the doctor may gradually reduce the dose to the lowest effective amount. In the case of arthritis, the initial dose of Medrol may vary depending on the type and severity of arthritis. The usual starting dose is around 4 to 48 milligrams per day, divided into multiple doses. As symptoms improve, the doctor may gradually reduce the dose to the lowest effective amount to maintain symptom control. For skin conditions like eczema and psoriasis, Medrol is usually prescribed in the form of a topical cream or ointment. The doctor will determine the appropriate strength and frequency of application based on the severity of the condition. It's important to follow the instructions provided by the healthcare provider and use the medication as directed. When Medrol is used in the treatment of certain types of cancer, the dosing will be determined by the healthcare provider based on the specific cancer type, stage, and individual factors. It is typically used in combination with other cancer medications and administered in a hospital or clinical setting. It's worth noting that dosing guidelines may vary depending on the individual and their specific condition. Always consult with your healthcare provider for personalized dosing instructions and recommendations. Potential side effects of Medrol. Like any medication, Medrol can cause side effects, although not everyone will experience them. The most common side effects of Medrol include increased appetite, indigestion, mood changes, difficulty sleeping, and fluid retention. These side effects are generally mild and temporary, and they typically go away once the treatment is completed or the dose is reduced. In some cases, Medrol may also cause more severe side effects, although these are less common. These side effects can include high blood pressure, increased risk of infection, osteoporosis, thinning of the bones, and adrenal suppression, reduced function of the adrenal glands. These side effects are more likely to occur with long-term or high-dose use of Medrol. It's important to report any unusual or severe side effects to your healthcare provider immediately. They can assess the situation and make any necessary adjustments to your treatment plan. Your doctor will weigh the potential benefits of Medrol against the potential risks and monitor you closely to minimize the occurrence of side effects. User experiences with Medrol. To gain a better understanding of Medrol's benefits and potential side effects, reading about user experiences can be helpful. It's important to note that everyone's experience with medication can vary, as individual responses and tolerances differ. However, hearing about others' experiences can provide insights and help manage expectations. Many individuals have reported positive experiences with Medrol, particularly in terms of symptom relief and improved quality of life. For example, individuals with asthma have shared how Medrol has helped to reduce wheezing, coughing, and shortness of breath, allowing them to engage in physical activity without limitations. Similarly, individuals with allergies have found relief from Medrol, experiencing a decrease in allergic symptoms such as sneezing, itching, and nasal congestion. This relief has allowed them to enjoy outdoor activities and improve their overall well-being. People with arthritis have also shared their positive experiences with Medrol, noting a reduction in joint pain, swelling, and stiffness. This improvement in symptoms has enabled them to engage in daily activities with greater ease and comfort. Individuals with skin conditions like eczema and psoriasis have reported significant improvements in their skin's appearance and reduction in itching and inflammation. Medrol has provided relief from the discomfort and embarrassment associated with these conditions, leading to improved self-esteem and overall satisfaction. While many users have had positive experiences with Medrol, it's important to acknowledge that some individuals may experience side effects or have different responses to the medication. It's crucial to work closely with your healthcare provider to monitor your progress and address any concerns or side effects that may arise. How Medrol works in the body. Medrol belongs to the corticosteroid class of medications, which are synthetic versions of the hormones naturally produced by the adrenal glands. Corticosteroids have anti-inflammatory and immunosuppressive properties, meaning they help to reduce inflammation and suppress the immune system's response. When Medrol is introduced into the body, it binds to specific receptors within cells. This binding process triggers a cascade of reactions that ultimately lead to a decrease in the production of inflammatory chemicals called prostaglandins and leukotrienes. By reducing the levels of these inflammatory chemicals, Medrol helps to alleviate inflammation and related symptoms. Additionally, Medrol suppresses the immune system's response, preventing the release of immune cells and chemicals that contribute to inflammation. This immunosuppressive effect can be beneficial in conditions where the immune system is overactive, such as in autoimmune diseases or allergic reactions. The precise mechanisms by which Medrol exerts its effects are complex and involve various pathways within the body. However, its ability to reduce inflammation and suppress the immune system plays a central role in its therapeutic actions. Alternative treatments to Medrol. While Medrol can be effective in managing certain conditions, it's worth exploring alternative treatments that may offer similar benefits. Depending on the specific condition and individual factors, alternative treatment options may be considered. For asthma, alternative treatments may include other types of inhaled corticosteroids, long-acting bronchodilators, and leukotriene modifiers. These medications work in different ways to manage asthma symptoms and reduce inflammation. In the case of allergies, antihistamines are commonly used to manage symptoms such as sneezing, itching, and nasal congestion. Nasal sprays, eye drops, and allergy shots can also be effective in reducing allergic reactions. For arthritis, nonsteroidal anti-inflammatory drugs, NSAIDs, are often used to manage pain and inflammation. Physical therapy, lifestyle modifications, and other medications may also be recommended to improve joint function and reduce symptoms. Skin conditions like eczema and psoriasis can be managed with topical corticosteroids, moisturizers, and other medications that target inflammation and promote skin healing. Phototherapy, or light therapy, is another treatment option that can be beneficial for certain individuals. It's important to consult with your healthcare provider to determine the most appropriate alternative treatments for your specific condition. They can assess your individual needs and guide you in making informed decisions about your treatment plan. Precautions and warnings when using Medrol. Before starting Medrol, it's important to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking. Certain conditions may require adjustments in the dosage or monitoring during treatment with Medrol. Medrol should be used with caution in individuals with a history of stomach ulcers, diabetes, high blood pressure, osteoporosis, or any mental health conditions. It's important to discuss these conditions with your healthcare provider to ensure that Medrol is safe and appropriate for you. Pregnant women and those who are breastfeeding should also exercise caution when considering Medrol. It is essential to discuss the potential risks and benefits with your healthcare provider, as they can provide guidance on the safest course of action. It's worth noting that Medrol can interact with other medications, including herbal supplements and over-the-counter drugs. It's crucial to inform your healthcare provider about all the medications you are taking to avoid any potential interactions or adverse effects. Lastly, it's important to follow the prescribed dosing instructions and not exceed the recommended dose of Medrol. Abruptly stopping the medication can also lead to withdrawal symptoms, so it's essential to work closely with your healthcare provider when discontinuing Medrol. Frequently asked questions about Medrol. Can Medrol cause weight gain? Medrol can increase appetite, which may lead to weight gain in some individuals. However, not everyone will experience this side effect. How long does it take for Medrol to work? The onset of action varies depending on the condition being treated. In some cases, individuals may experience relief within a few hours, while in others, it may take a few days or weeks. Can Medrol be used long-term? Medrol is generally used for short-term treatment due to the risk of side effects with long-term use. However, in certain cases, such as autoimmune diseases, it may be necessary to use Medrol for extended periods under close medical supervision. Can Medrol be taken with other medications? Medrol can interact with other medications, so it's important to inform your healthcare provider about all the medications you are taking to avoid any potential interactions. Can Medrol be used in children? Medrol can be used in children under the guidance of a healthcare provider. The dosage and duration of treatment will be determined based on the child's specific condition and needs. Conclusion and final thoughts on Medrol. Medrol is a versatile medication commonly prescribed for various conditions, including asthma, allergies, arthritis, skin conditions, and certain types of cancer. With its anti-inflammatory and immunosuppressive properties, Medrol helps to alleviate symptoms and improve quality of life for many individuals. When using Medrol, it's important to follow the prescribed dosing guidelines and be aware of potential side effects. While many users have positive experiences with Medrol, it's important to consult with your healthcare provider and monitor your progress closely. Alternative treatments may be considered depending on the specific condition, and precautions should be taken in certain individuals, such as those with existing medical conditions or during pregnancy or breastfeeding. By understanding Medrol's primary uses, dosing guidelines, potential side effects, and user experiences, you can make informed decisions about your treatment plan and work collaboratively with your healthcare provider to achieve the best possible outcomes.